Hello, my name is CJ1. Today I will talk about tooth whitening. Tooth whitening or tooth bleaching is the process of lightening the color of human teeth. Whitening is often desirable when teeth become yellowed over time for a number of reasons and can be achieved by changing the intrinsic or extrinsic color of the tooth enamel. The chemical degradation of the chromogenes within or on the tooth is termed as bleaching. Hydrogen peroxide is the active ingredient most commonly used in whitening products and is delivered as either hydrogen peroxide or carbamide peroxide. Hydrogen peroxide is analogous to carbamide peroxide as it is released when the stable complex is in contact with water. When it diffuses into the tooth, hydrogen peroxide acts as an oxidizing agent that breaks down to produce unstable free radicals. In the spaces between the inorganic salts in tooth enamel, these unstable free radicals attach to organic pigment molecules, resulting in small, less heavily pigmented components. Reflecting less light, these smaller molecules create a whitening effect. There are different products available on the market to remove stains. For whitening treatment to be successful, dental professionals should correctly diagnose the type, intensity, and the location of the tooth discoloration. Time exposure and the concentration of the bleaching compound determines the tooth whitening endpoint. Now you talk about whitening shade. Whitening shade guides are used to measure tooth color. These shades determine the effectiveness of the whitening procedure, which may vary from 2 to 7 shades. These shades may be reached after a single in-office appointment or may take longer, depending on the individual. The effects of bleaching can last for several months, but may vary depending on the lifestyle of the patient. Consuming tooth-staining foods or drinks that have a strong color may compromise the effectiveness of the treatment. These include food and drinks containing tannins such as coffee, tea, red wines, and curry. In office, bleaching procedures generally use a light pure protective layer that is carefully painted on the gums or papilla to reduce the risk of chemical burns to the soft tissues. The bleaching agent is either carbamide peroxide, which breaks down in the mouth to form hydrogen peroxide, or hydrogen peroxide itself. The bleaching gel typically contains between 10% and 44% carbamide peroxide, which is roughly equivalent to a 3% to 16% hydrogen peroxide concentration. The legal percentage of hydrogen peroxide allowed to be given is 0.1 to 6%. Bleaching agents are only allowed to be given by dental practitioners, dental therapists, and dental hygienists. Bleaching is least effective when the original tooth color is grayish and may require custom bleaching tricks. Bleaching is most effective with yellow discolored teeth. If heavy staining or tetracycline damage is present on the patient's teeth, and whitening is ineffective, require prolonged bleaching as it takes longer for bleach to reach the dental layer. There are other methods of masking the stain. Bonding, which also masks tooth stains, is when a thin coating of composite material is applied to the front of a person's teeth and then cured with a blue light. A veneer can also mask tooth discoloration. In-chair whitening is faster and more effective in comparison to the take-home bleaching options. Some clinicians also make custom bleaching trays, which can take up to 2 weeks to create. After the whitening treatment is completed, the patient is able to use these trays for maintenance of the bleaching with at-home kits or for use with desensitizing products. Lastly, I will introduce light accelerated bleaching. Power for light accelerated bleaching uses light energy, which is intended to accelerate the process of bleaching in the dental office. Different types of energy can be used in this procedure. The most common being halogen, LED, or plasma arc. Use of light during bleaching increases the risk of tooth sensitivity and may not be any more effective than bleaching without light when high concentration of hydrogen peroxide are used. The ideal source of energy should be high energy to excite the peroxide molecules without overheating the pulp of the tooth. Lights are typically within the blue light spectrum, as this has been found to contain the most effective wavelengths for initiating the hydrogen peroxide reaction. A power bleaching treatment typically involves isolation of the soft tissue with a resin-based light curable barrier, application of a professional dental-grade hydrogen peroxide whitening gel, and exposure to the light source for 6 to 15 minutes. For any whitening treatments, it is recommended that a comprehensive examination of the patient is done, including the use of radiographs to aid in the diagnosis of the current condition of the mouth, including any allergies they may be present. The patient will need to have a healthy mouth and free of periodontal disease or cavities, and to have had the debridement cleaned down to remove any tartar or plaque buildup. And it is recommended to avoid smoking, drinking red wine, eating or drinking any deeply colored foods after these, as these may stain considerably straight after treatment. Thank you for listening.